Now back to Gary Rivers on WHBC.
All right, got all my technical difficulties out of the way. It's 20 minutes after 10 o'clock, and we're going to the phone right now to talk to Dr. Khan, who is a plastic surgeon, and so looking forward to talking with her about this phenomenon. Good morning, doctor.
Thank you for having me. Good morning.
Hey, I appreciate it. So this is a millennial thing, this phenomenon of spending tax dollar, your tax refund, and up to 36% of Americans using their tax returns for cosmetic surgery surprised me. That's a huge number.
Yeah, but, I think since the beginning of this year, we've definitely seen a lot more interest in cosmetic surgery, and our numbers are up actually about 30 to 40%. So it really doesn't surprise me that people are, they have a little bit more disposable income. The economy, it looks like it's a little bit stronger. People at least feel more confident that the economy is stronger, and so they're willing to spend more on themselves.
I was stunned at the 20-somethings doing it. Are we that concerned? Is it vanity or is it real perceived need when folks are doing this?
Well, I think part of it is, we are in the age of selfies. And so I think people are just more aware of how they look, and we document all aspects of our lives. So we're on Instagram, we're on Facebook, we're on Twitter, and people are always taking photos. And so I think at a younger age, in your 20s and your 30s, that's when people are starting to realize, okay, maybe my lips aren't as full as they used to be, or maybe my cheeks aren't as full. And so they're seeking cosmetic procedures. I think another thing that goes with that is that a lot of people think Botox and some fillers, these procedures can also be preventative in a sense. And so they are willing to start them in their 20s so that hopefully when they're in their 40s or 50s, they don't necessarily need a full facelift or, whatever. So I think that there's two things that kind of go hand in hand of why younger people are opting for cosmetic procedures.
All right, so can Botox really stop an upcoming wrinkle?
Well, what Botox does is it actually stops any animational wrinkles, but so that means when you're actually trying to animate, not necessarily a static wrinkle or a wrinkle at rest.
Okay, that makes sense.
But what it does is as you get Botox, every 3 months, eventually what happens is it feathers out a lot of the wrinkles that you actually have at rest. And so in a way, it is almost becoming preventative. And, if you can't animate, you're not going to make that wrinkle, right? So the whole point is trying to get to that point when you don't necessarily need as much anymore.
All right. What about the phenomenon of people wanting to look like celebrities? I've seen the people who spend a fortune, it seems, looking like Barbie, but the new Ivanka Trump phenomenon, I know that's mostly in China, where she's become almost a rock star. Do you see that in your office?
Yeah, I haven't actually had anyone ask me to, look exactly like her, but I think she is very pretty. Obviously, she's a beautiful lady. She's confident. She's strong. She's on TV, and women are attracted to her because of that. So women have said, well, I'd like to have full lips like she has, very full lips, or she has higher cheekbones. That is more common than I think someone saying, I want to look exactly like her.
I was going to say, if somebody comes to you and says, I want to look exactly like her, do you refer to her to the mental health services, or do you actually help
pretty much. No, exactly. Because I think at that point, I cannot help her.
Okay. Because it seems to me, I see this. There was a report, I think 22 people had plastic surgery just to look like a celebrity, and I'm like, what?
Yeah, I agree. I'm sorry, go ahead.
No, that's fine. It just threw me off that there were actually people like that, and I felt they need more mental health services than they needed plastic surgery services.
Yeah, I agree. It's just like the woman you said who wanted to look like a Barbie doll, or the woman who, wanted to be the Catwoman, or there was a guy who wanted to look like Justin Bieber a couple of years ago. And the problem is when that's their goal, they're going to be very disappointed, because at the end of it, they're never going to look like that celebrity, and they'll have dropped $50, $60, $100,000, and they don't get what they expect. And so I think as a plastic surgeon, really just from an ethical point of view, it's really our job to tell our patients, no, you will never look like that person. You do not have those genes, because you don't want to mislead anyone.
And they have to be realistic, right? I mean,
Exactly.
am I correct? It's an inexact science. You're not really sure until you take the bandages off that it's going to be what you wanted exactly?
Well, I feel like plastic surgery, it's definitely an art and a science. It isn't, an exact science. And there are certain factors that we cannot control. For example, how a person's body heals really is something that I have no control over. So even though I can control every other aspect of the surgery, I have no idea at the end of the day let's say if they're prone to making thicker scars, for whatever reason, they are going to make a thicker scar. So you're right. So there are some things that I just can't control, but I think these people who come in and have very unrealistic expectations, the best thing you can do as a plastic surgeon is probably not to operate on them because at the end of the day, again, they are never going to be happy. And you're almost kind of misleading them by saying, oh, yes, I can make you look like Giselle or I can make you look like Angelina Jolie, when in fact you can't.
All right, plastic surgery, is any of it handled through insurance company, or is this almost always out of pocket?
Only the reconstructive cases are typically handled in insurance. So, for example, women who have breast cancer and have to undergo mastectomy followed by breast reconstruction, that should always be covered under insurance. But all the cosmetic procedures are typically out of pocket.
Okay. So, and that's it. And then it can get very cost prohibitive unless you happen to be in a pretty high tax bracket. A small plastic surgery, what would it run? Is there a typical price range?
Sure. I mean, actually, I think that the cost of plastic surgery has actually come down probably in the past 10, 15, 20 years. And so it's actually become much more accessible to, the masses. So I think maybe 20 or 30 years ago, it used to be something that only the ultra-rich or the Hollywood elite could get. But now, I mean, my average patient is the average housewife. And so Botox will range anywhere from maybe $400, $500, $600, whereas a breast augmentation maybe $6,000, $7,000. And then, typically the mommy makeovers, the bigger cases, the cases that involve breast and tummy tucks and lipo, those can be $10,000, $15,000. But typically
But the typical smaller ones, almost anybody could afford. That would make sense. I'm not sure if
exactly.
I shell out $10,000 to get a tummy tuck, but on the other hand, if my diet's not working, that might probably save me money in the long run. I don't know.
Yeah. I mean, I think it all depends on, is it worth it to you? And I always tell that to my patients. If it isn't worth it to them, there's no point in going ahead with it because at the end of the day, it's elective surgery. No one needs it.
Yeah, and most people, when you see them, this is it's been something that's been weighing on their mind for a long time, isn't it? It's not something they take lightly. They come to you and they say, look, I've never liked my nose, or I've never liked this about me. Can you help me? Is that what you see?
I do. And, I think recently I have seen a lot more people who have just lost a lot of weight. And I think with the popularity of a lot of the weight loss procedures like the lap band and the gastric bypass, people are losing 50, 60, 100 pounds. And the problem is they lose this weight, but then they have all this excess skin. Mm-hmm. And it's hard for them to find clothes that properly fit. And so they just want to come and get a tummy tuck or get a breast lift, and it helps them kind of complete their transformation.
Yeah, and unfortunately, while that surgery is covered, that your part of it isn't, right, from insurance companies.
Exactly. Yeah, because it's cosmetic.
Although to them it's not. It's an emotional trauma.
Mm-hmm. And I mean, I think for them, when they go into it, they typically know that, and so patients that we see will say, well, I've been stable at this weight for the past 2 or 3 years. I saved up. I knew this is something that I wanted, and so now I'm ready.
All right. Well, Dr. Farah, thank you so much, Farah Khan, for joining us this morning. I really do appreciate it. Give me a little insight into this, and now I feel a little bit better. It's great. I'm just still blown away that 20-somethings are that worried about it over their selfies, but I guess I get it now.
Exactly. It's just the rise of selfies.
All right. Well, I'm going to go take my picture, and I'll just airbrush it a little bit. I got that. That's what my team will do for me and make me feel a little bit better. All right. Thank you so much. Have a good day.
Well, thank you. You too. Bye-bye.